What are the rates looking like?
So all summer long, we were well below 5%. Starting in early August, that number started to tick up. And I like that number because it sort of precludes what's happening in our hospitals and our ICUs. So as that number starts to tick up, that corresponds nicely to what we expect to see in the hospitals. And sure enough, hospital numbers started to tick up throughout August, and we eclipsed 5% test positivity in the Metro Detroit area, Oakland, Macomb, and Wayne County. Throughout the month of September, community test positivity numbers have ranged anywhere from around 5 to 10%, which is pretty high. Just again, for perspective, when you go back to some of our big surges like March and April, or if you go back more than a year ago to some of our earliest surges, those test positivity numbers were in the 20s. So relative to where we were, I think you can say we're a little better, but we're still experiencing what I would call moderate to substantial community transmission.
Obviously, there are kids going back to school. So is there any concern about a spike in transmission just because this is a time of year where people normally get sick, people normally catch colds and all sorts of things?
Yeah, I do expect to see more COVID activity as the weather cools down, as people start gathering more indoors, as the complacency sets in, the masks aren't being worn. Kids back in school, as you mentioned, I think those are all things that can potentially drive transmission up. Now, I also have to say that this whole experience has taught me nothing, if not to be humble, because there's a lot of characteristics about this virus and this pandemic that we don't completely understand. It makes sense to think that we'll see more transmission when the weather cools down because those conditions favor more transmission. But at the same time, we've also seen parts of the country that have had incredibly big surges during warm weather times, where people are spending time outdoors more. So it doesn't follow a perfect pattern. But yeah, as I've said before, I think we would be foolish to not prepare for a potential fourth wave.
What's the idea behind getting a booster? It seems pretty obvious, but I just want you to elaborate on that a little bit.
The data has shown that after about 5 months, the amount of protection that you have from the vaccine dwindles slightly, and your risk of getting a COVID infection seems to increase. Now, your risk of having severe complications from infection still remains extremely low. In other words, even after that 5-month mark, you still have good protection from getting hospitalized, ending up in the ICU, ending up on a ventilator. And that's an important point to mention. But your total protection from COVID is less. So with that in mind, and with the fact that we do have still a lot of virus in our communities, the ACIP, which is the Advisory Committee on Immunization Practices, which is an independent committee of the CDC, concluded that boosters are recommended for certain populations, specifically folks that are less likely to have a robust immune response from the vaccine. Older folks over the age of 60, people with compromised immune systems, and people who work in high-risk positions like healthcare workers and teachers, et cetera, benefit from getting a booster jab to help bring that immunity back up to those nice high levels of where they once were and continue to provide that protection. I suspect it won't be long before we start talking about booster jabs for the entire population. But as of right now, the data really doesn't point us in that direction just yet.